Stephanie.
I'm Dan.
And this show is airing on Juneteenth. And so I wanted to have a guest today to address some of the issues of the day in our world of autism and special needs, neurodiversity that is relative to today. So I decided to make this whole month of June about diversity, equity, and inclusion. So you may have kind of seen that theme so far. We started off June with Peter Mann, and he was talking about neurodiversity in the workplace. Then Dr. Ramos Campbell, where we talked about multiculturalism and special needs and things that churches and clinicians need to know. So today we have Dr. Mary Jones, and we'll be rounding up the month with Jillian Palmiato on church inclusion. So welcome today for our special edition of Juneteenth, Dr. Mary.
Thank you. I'm so happy to be here with you guys and looking forward to kind of delving more into this topic of disparities in autism care.
All right.
Thank
Well,
you
I'll
guys
tell
for
you
having me.
I'll tell you all a little bit about Mary. She's a pediatrician and a PCCI-trained life and leadership coach. She believes there's a greatness in each of us and is passionate about equipping and empowering women to reach their fullest potential. Throughout her life and career, she has had the privilege of working to empower and equip women and girls to be their best selves. Her vision is to see women living out their purpose and affecting change in their own spheres of influence.
And we are definitely going to end there because I want to know more about that. So for women who want to reach out to you, but we always like to start our shows out, Mary, with what's the personal journey? You are a trained pediatrician and other life coach training, but what's your journey into autism and neurodiversity? What would you like to share with our listeners about that?
Yeah, so I would say my journey started professionally. I as a pediatrician, have treated lots of patients with autism spectrum disorder, from Asperger's type to just really severe autism. And I've always loved those patients and their families. About 3.5 years ago, it became a personal journey as well. My husband and one of my sons were diagnosed around the same time with ASD. My son was 11. My husband was, I was thinking about this, 46. And so I'm like, talk about late diagnoses. And my husband's a physician and I'm a physician. So, I was thinking about imagining how if it could be that long for our family with the resources that we have available to us. Imagine a family that didn't have those resources. And so that's why I really am an advocate for families with autism, especially those that are underserved.
Okay. So I guess we're going to be kind of going into it a little bit more because I sometimes people, clinicians, counselors, teachers, various doctors, it's like, how did we miss this? How did we miss this when this is our training? So was that kind of part of your journey as well? Like we're two doctors and you specifically a pediatrician. So just kind of like think to the clinicians out there, because sometimes there can be a little bit of a barrier. Not understanding maybe there's some additional training that's needed besides your MD or PhD in this field.
I would say for sure I went through that. I'm actually who diagnosed my husband, just because there were just some things that weren't adding up in our marriage. And I'll say that my husband is white, from a close-knit mid Western family, and he grew up his whole life, and I guess he was a little bit different, but there was no formal testing. And with my son at 11 years old, he had already started exhibiting some symptoms in school, also at home too, but it just didn't make sense until we were able to diagnose my husband. And so And I will say too, because I know everybody always wonders this about pediatrician, I don't see my own children. Like they have, since they were born, gone to the pediatrician for their well checkups, and it was missed there as well. And so I think for clinicians, it is a difficult thing when you are in the trenches of it. You're raising your family, and you don't necessarily key in on those things that you would key into for one of your patients.
Good point.
So, Mary, there's statistics, and I'm sure you're aware of these from the CDC, that ASD occurs in all racial, ethnic, and socioeconomic groups, but it's reported at the highest in the non-Hispanic and white children, lower in Hispanic and African American or Black children, and highly variable in Asian Pacific Islanders. Yet supposedly it affects everybody. In theory, it's reasonable that it affects everybody equally. So speak to the difference across the, what about those segments of the population causes the rate of diagnosis to be so drastically different?
And you're absolutely right, Dan. The prevalence or the amount of people in each of those populations that has ASD is the same. There's no difference. But the reason that there's less children in Latino and Black families that are diagnosed is because of access to care. There aren't a lot of studies that have been done on why this is, but people are starting to recognize it. And I was doing some research for this podcast myself, and was reading some articles in the Journal of Pediatrics. One in specific that I'd like to kind of highlight some points from. And I'm going to say the title and the author so that, I can give credit where it is due. It's called Disparities in Service Use Among Children with Autism, a Systematic Review, and it's by Smith et al. And it's volume 145, supplement 1 in the Journal of Pediatrics. And so they looked at disparities racially and socioeconomically in kids with ASD and how that affects their age at diagnosis and also access to care and services. And one point that they made is that there is evidence that racial and ethnic minority groups and children from low-income families have less access to acute care, specialized services,